So in this module of videos, what we're going to be talking about is strength and endurance. So with most sports and really any activities of life, you need strength to accomplish those. So the exercises that we have are going to be for individuals that have had an injury or are just not very well versed in these movements and need that additional strength. The biggest thing you need to be considering when you're doing these exercises is not overdoing them. A lot of people, they'll go in and they think they can lift a lot of weight or some of these exercises. Well, I can do more than what people say. But then we'll get this muscle soreness or DOMS, late onset muscle soreness. That will last for longer and that will discourage them and say, oh, I don't need to do it anymore. That was too much. And kind of put a bad taste in their mouth. So the biggest thing is when you're doing it, start light, start easy, and then work your way up. It's easier to add more weight and add more reps than it is to try to take something away where you could possibly cause muscle damage or that muscle soreness that decreases compliance.
So then our contraindications or reasons we wouldn't do strength and endurance exercises are for those that have sustained acute injuries such as a fracture, compartment syndrome, any severe joint, tendon or ligaments injury. We wouldn't want to do that as well. And then sometimes when we don't want to move the joint within those acute injuries or just post-surgical, those are also contraindicated where we may not be doing a lot of the exercises that we're doing with these patients. However, there are other exercises and ways to build that strength without using strengthening exercises themselves. These types of non-moving tools we can use for those patients are neuromuscular re-education stimulation with our therapeutic modalities and re-educating the muscle using electrical stimulation, or we can use isometric contractions where we're building the strength isometrically, just not moving the joint into any specific range of motion. And again, just as Eric said, just being aware of our patient, their needs, their comfort level, their confidence levels in anything that we're doing, whether that be flexibility or muscular strength and endurance, and being aware of how they're feeling, and if it's too light, maybe bump them up, but also being aware of soreness as well. So